My name is Dr. Rafael Prieto, and I want to take a few minutes to discuss prolotherapy. Prolotherapy was the first regenerative injection treatment started in the 1950s by Dr. George Hackett, and he found that in cases of chronic injuries, he was able to effect some relief of the pain by injecting substances that would trigger the body's own healing response. So this is kind of a busy slide, but we're going to go through this in the next few slides to go through the different stages of healing. So down at the bottom you see the time in days after an injury, and on the y-axis on the left you see the maximal response of the tissue to the injury. Now at the red arrow here is where injury occurs on day 0, and as a response to this injury, and this injury can take the form of many different types of events, such as lacerations or sprains or strains. And what these injuries have in common is damage to blood vessels, causing stasis of blood through the area, which triggers platelets that are within the blood vessels to aggregate in the area and stop the bleeding, and also release factors which attract other cells to the area. In this first phase, what we usually see is white blood cells being called to the area in order to repair or to respond to any bacteria or other pathogens that may have been introduced, but also to clear the debris of the damaged tissue. So this occurs first thing after the injury. The next wave of cells which are brought into the area are lymphocytes and cells such as mesenchymal stem cells, which also are called into the area in order to direct the healing process. So this is inflammation, and as you can see, there's an early and also a late stage. So it's usually called acute and subacute inflammation respectively, in terms of the early phase being the acute phase and the late phase being the subacute inflammatory phase. So after the late phase, you have fibroblasts that are within the tissue start to divide, or what we call proliferate. And the cells will proliferate and also produce collagen, which is accumulated in the area in order to restore strength to the injured tissue. So as you can see, after about 2 months, over on the left, collagen accumulation will level out. And if the repair mechanisms haven't restored function to the tissue, the response has been leveled out, so it needs to be restarted, and that's what prolotherapy does by mimicking an injury and having the body go through all the steps in order to effect repair. So right here we have a diarthrodial joint, a diagram, a simplified diarthrodial joint, which is the most common type of joint in the body. The joint that occurs in that is present in the hips and also in the knees, and also in the facet joints of the back. So when we strip away all the names of the different structures, we're left with this joint. And after an injury or through time, aging of the joints, in many cases the repair mechanisms are unable to keep up with the wear and tear that the joints are subjected to. So in prolotherapy, we have the degenerative joint here. Prolotherapy, you introduce via a needle a proliferant, and the proliferant can be different substances. The most common one used is dextrose. That's the one that we use here. But low concentrations of phenol have been used over the years, as sodium morowate, which will also evoke that mimicking of an injury and evoke a healing response. So after you introduce that proliferant into the area, then you have the development of inflammation like we saw in the graph in the first few slides. And so when the acute inflammation dies down and the subacute inflammation dies down, we have the fibroblasts which have made collagen in order to repair the defects that occur within the connective tissue. And hopefully this also will restore function and decrease pain in the painful structures. If you would like to learn more about prolotherapy, Dr. Wilson and I are both experienced in the procedure. We have locations in Hendersonville and Nashville, Tennessee.